Good afternoon to everybody for joining us. On behalf of the College of Public Health Alumni Society and our co-sponsor, the Diversity, Equity, and Inclusion Committee of the HSMP Alumni Society, I want to welcome all of you to today's talk, Empowering and Advancing Minority Women in Healthcare and Public Health. Before introducing our speaker, I first want to thank Zeb Purdon, Kaylin Hutchinson, Reed Franklin, Lisa Sloan, and Emily Zion for helping organize today's talk. I also encourage you to type questions in the Q&A box below. Reed Franklin will be reviewing those and helping lead the Q&A at the end of today's talk. To be a leader today and truly transform how care is delivered and how new generations of leaders are trained requires not only brilliance, but perseverance. I want to welcome Dr. Nwando Olayiwola. We are tremendously lucky to have her joining us today. I'm sure we are going to walk away inspired by her vision and her ethos. I won't go into too much of her background, but I can just assure all of you that she is somebody that inspires those around her and has truly excelled regardless of where she is. And we are so happy that she is back to Ohio State and one of the best leaders that we could have in our community. So without further ado, welcome Dr. Olayiwola.
Good afternoon. Thank you so much, Naomi, and thank you to all of you for having me here. I'm really looking forward to having this conversation with you today, and want to thank all the organizers of this event for thinking of me and including me, and for all the work that's gone on behind the scenes to transition this to a virtual experience. So I'm really looking forward to speaking with you all today and sharing my work, particularly around the elevation of minority women in medicine, public health, and healthcare more broadly. So I'm going to share with you something that's called the Minority Women Professionals, or MWPs, or MVPs, mission and movement. And you're going to hear a lot more about this today. It's something that I founded and started back in 2017, but really a lot of parallels that I think they're important for us here. So first we're going to go into just a few learning objectives. I'm going to share some what I've learned over years that have been some essential ingredients or attributes of success for minority women professionals that are in the public health space and in the healthcare space. And then hopefully you'll have a couple of strategies by the end that will help you think about how you could empower and equip minority women professionals for careers in public health and healthcare leadership in your from wherever you sit. And I believe that every single one of us sits somewhere where we can empower someone else. And so I believe that it doesn't matter whether you're a student or you're working in your career, or you're a physician, or you're in a public health organization. I think that there are opportunities for everyone. So that the three things that I think you'll hear if you hear nothing else is that minority women professionals are underrepresented in public health and healthcare leadership. But building partnerships with colleges of medicine, schools of public health, offices of diversity and inclusion can really get us success nationally and also wherever you are locally. So I'm going to tell you a little bit about my journey and appreciate the opportunity to share that I was born a Buckeye and went to Ohio State for my undergraduate and medical school education. And in that space, as far as back as I can remember, I have had a very strong commitment to diversity, equity, inclusion, community health. And it's been amazing to come back to where I started. When I finished my medical school, I went to Columbia, New York, where I was a resident in family medicine. And I finished that and I went to the Harvard School of Public Health, where I got my master's in public health with a focus on health policy. And it was really an opportunity for me to learn how to take a lot of what I was interested in, what I was excited about in clinical medicine, but see it on a scale that was much broader than the individual patient encounter. And as I was going through my medical residency, I hadn't actually had that much exposure to public health as a profession and as a career path. And so, I was doing work. I started a nonprofit in New York City that was working on HIV/AIDS education and prevention for minority adolescent females in New York City public schools, and doing a lot of work around that program development evaluation. And one of my mentors said to me, "You are a public health person, so you need to go and study public health." So I was fortunate to get this Commonwealth Fund Harvard Fellowship for minority physicians who are interested in public health and health policy, and I went to do that. And then I went to work as a chief medical officer of a large, fairly qualified health center system in Connecticut. I went and started as a primary care physician there, and then became the chief medical officer for the network. And then I was recruited to University of California, San Francisco, where I had the opportunity to direct what's called the Center for Excellence in Primary Care, and really think about how to integrate technology better into primary care, how to make primary care more efficient and effective, and how to make sure that health equity initiatives were built into the fabric of primary care delivery. From there, I went to a startup, worked for a technology company called Rubicon MD that focuses on using electronic consultations to bridge the gap between primary care and specialty care physicians. And was really an interesting opportunity for me, being in the less than 1% of women of color physicians who were in leadership careers and C-level leadership careers in technology companies. Was certainly a challenge, but did offer me the opportunity to open a lot of doors and access and visibility into STEM careers for young women who did not see women that look like them in those kind of companies. And then in the middle of that, I was able to start this program that I'm going to share more with you about, because I do think it has a lot of parallels to the work that you're doing, and will give you maybe some ideas on how to think about investments you're making. And then I came back to Ohio State in my role as chair of the Department of Family and Community Medicine. Right now, I'm also the founding director of the Center for Primary Care Innovation and Transformation, which has a very strong focus on health equity as one of its core pillars. And I'm co-chairing the Wexner Medical Center and Health Sciences College's Anti-Racism Action Plan. So let's get into what I want to share with you. So why did we even feel, and why was I sitting back there in 2015, 2016, struggling with, I feel like I need to do something for minority women and professionals in the healthcare space, and I need to do something. Why was this even necessary? And why was it important to start to do this? So there's a lot here, and I don't want to go through all of it, but one of those things that was really important was that, how am I even going to define what a minority is, right? And for this purpose of this movement, it was really that we felt any woman that identified as having some sort of marginalized identity, whether that was based on race, ethnicity, or religion, or older age, or being an immigrant, having a disability, lower socioeconomic status, gender identity, LGBTQ, people that felt like they were marginalized on some part of their background or identity, were the people that we were thinking of. And you may have all heard that story, about Tamika Cross a few years ago, where she was on a Delta flight, and she's a Black physician, and they needed help for a patient, a passenger that was on the plane. And the flight attendants rejected her and didn't believe that she was actually a physician as a Black woman. So you kind of see these micro and macro insults on women of color, of other minority women, all the time. And it starts to affect you. And when you're in your space where you are, like for me, as a woman of color physician, or in some of the public health work I've done, you don't see a lot of people that look like you, or identify like you, or have shared experience or shared lived experience as you do. And so it can be very, very lonely. And so bringing people together to start to just hear those perspectives, to validate your worth, to remove some of the imposter feelings, was very, very important to me. And so there were so many different other things that were part of this problem, that, for physicians, there's a significant gender gap between women and male physicians, with women on the average always making less. But this actually is a reality that happens across different professions. So outside of healthcare, and I was reading a lot of stuff about technology companies, attorneys, and minority women. 85% of minority female attorneys will leave a large firm within 7 years because they feel like they have no choice. A lot of backlash experienced by Asian American female scientists because they are, if they're seen to have stereotypically masculine behaviors, then they have trouble in their workplace. And so just a lot of things that I'd noticed, and also knew that a lot of minority women that have come to me have struggled to find mentors in their profession, and especially as they rise in their ranks, there's just not enough of those people in the leadership positions to provide the mentorship that is needed. And then if you look at medicine, and this is a snapshot from medicine, but I'm pretty sure like public health looks very, very similar. And this is the kind of the state of women in academic medicine. This is published by the American Association of Medical Colleges, Association of American Medical Colleges, the AAMC. They look at the state of women, and what you can see on this very brief snapshot is that, while you have almost 50% of applicants to medical school being female, and you have a similar number for people that end up matriculating and become residents, you can see the drop off on this as you go to faculty, down to 38%. And then another drop off if you want to look at full professors. And then if you want to look at deans, down to 16%. So for women, although you might have half of your class in medical school, if you're going to medical school as females, it's going to be only 16% of deans will be women. So that is a really, really important and staggering reality that we have to contend with and figure out how do we address. When you look at women in healthcare in general, only 16% of chairs are women, as we mentioned. But when you look at underrepresented women and minorities like me and looking at chairs, I am a chair, but I'm in a very small number of 1.3% of chairs in medicine are women that are from underrepresented backgrounds. And that is a very, very low number. And so, I mean, but women in general are still not well represented as chairs, but certainly women like me are not. And that's the same thing in highest level of hospital level leadership as well. So just very low numbers of women in the C-suite. So when the AAMC did a survey asking women, what do they need to succeed? And, when you think about the things that they're asking for to be able to have, satisfaction with their workplace, the things that they want are not really things that are hard to do. They want clear expectations about their role and the path to advance. They want an equitable and diverse workplace, and they want access to opportunities for development and advancement. And there's nothing really there that is so earth-shattering that it cannot be accomplished in the places that educate women in public health and healthcare and nursing and in the other health professions in medicine. Just clarity, equity, and access. So these are the things that I've really felt very strongly about thinking about when I was trying to build this program. But you might wonder, well, why does it matter at all to have underrepresented women faculty in your colleges of public health or your colleges of medicine or nursing? Well, there's a lot of evidence that the diversity and representation in those areas helps you to think really differently about the research agenda. It improves the teaching experience for all students, gives you improves access to public health and access to care in underserved communities. And when you have diverse faculty, there are different approaches that they use that can actually really lead to increased student learning and retention, so the whole learning environment benefits. So this is what we created and what the movement has looked like. The Minority Women Professionals are MVPs. Initially, the idea that I had was to do it as a conference series, go all over the country and bring women together in cities across America to really draw power from each other in these networks that would be fostered by this national movement, but really built deeply locally. And then I decided to do that. It would be really effective to have some sort of playbook on what this might look like. And so I wrote a book called With the 10 Essential Ingredients. And from interviews and case studies from friends and colleagues who were women who had succeeded in various careers, trying to figure out what were the things that they had in common, and came up with these ingredients, which I'll talk about in a moment. But it really became not just about the conferences after a minute. It became really more about a movement, and how do you get people all over the country to be part of a grassroots movement to engage and inspire and make sure that women in healthcare areas and the public health professions are not just surviving, but that they're actually thriving. And so these are the 10 ingredients that I came up with from learning from all those folks and put in that book. But being able to embrace your roots and understand and appreciate and find value in your differences. Finding what we call ladder sisters, so people that will help you up the ladder, and also building sister circles, networks of people that can support you, even if you're the only one in your space. So for example, I am one of 2 Black women chairs in the College of Medicine in Ohio State, which is pretty incredible, actually. But I also have a network of sisters across the country who are, women in healthcare administration leadership or in medical leadership that have been really supportive for me as a sister circle. Figured out how to seek and utilize mentors, bringing others up. So just as someone helps kind of get you somewhere, also remembering to bring other people up as well. Figured out how to be okay with not having perfect juggling act. So that's a play on words. Finding a way for self-care and enjoying the things that you enjoy. Learning when to say yes, how to say no, and sometimes when it's important to say maybe. Dreaming big and trying to kind of exceed those dreams. Being excellent and being extra, and then finally being okay with failure, because failure can often drive some of the best successes. So, we packaged this up into this conference series, brought together people from across the country, and sometimes across the nation, to learn together, to network together, to grow together, with the hope that they would continue these relationships after we had left their city. It's been really inspiring to see how that has worked. And so I always say, like, if you don't see it, create it. I looked for conferences that would do what I was hoping to do. Didn't really see something like this. And so with a small team of volunteers and some really incredible women that are so dedicated to getting this right, we started to really think about how do we make this series focus on cultivating these really strong networks of sisters, helping people develop personally and develop their own career ladder, setting goals for their own career, figuring how to build a strategy for their own brand and development. And then also giving guidance on career strategies and teaching some skills that women and women of color and other minority women often have a difficult time doing, like negotiation and mediation, or learning how to say no, or figuring out how to prioritize. And so really providing leaders in those respective cities that would actually help people understand how to do these kind of things. And so we had a number of different cities. I just snapshotted a few to share, really about a lot of fantastic women from all over the country to come and provide, guidance and thoughts here. And we talked about, harnessing she power, making sure we don't forget about advocacy for Asian, Muslim, disabled, and women who identified as LGBTQ in any of those categories. And then also thinking about, like, how do we as women figure out how to protect some of the most vulnerable among us, victims of human trafficking or refugees, thinking about how to live a life of advocacy and activism, and creating inclusive learning experiences. And then, dedicated a whole part of one of our meetings to disability, because we felt like, women with disability often are not even thought of when people are thinking about programming and events and inclusion. So really making sure we dedicated time to take care of and provide some attention on that area. But a number of different wonderful topics and fabulous people to come together. So I want to share with you a very quick video from one of the conferences. And in fact, this is the first conference. So it's from 2017. It's a little bit dated now, but I like it so much because I think it really does show that combination of women in high levels of leadership, but also students early in their career. Some were thinking about public health or thinking about medical school or thinking about nursing school. Some had already decided and were in those professional schools. Some were, out of those education, but in their training phases. And it really just shows all the examples. And then also making sure we created spaces at these meetings for women who were even younger and for girls to feel like they had a floor and access, and combining things like movement and dance and entrepreneurial spirit, as well as, like, didactics and education. So I'm going to show you a quick clip from that first meeting. So that was just a brief look at that. And I think hopefully that video you saw the diversity in age and race, ethnicity, religion, ability that was represented, and really part of trying to build a network that continues to persist. So I'll tell you a little bit about who we've reached out to, what they felt, who we've reached. Each conference had somewhere between 100 and 300 women, trainee students, other guests from all ages and backgrounds. This is just a general look at a lot of our women were between the ages of 19 and 40, but definitely had women in the 40 to 65 plus area, and identified as minorities in a number of different ways. This is just from 3 of our sites, but largely by race and ethnicity, but women who identified with all those other domains over the last few years. had a lot of great people that done organizations that came on and sponsored these partnerships with universities and colleges of medicine and actually schools of public health. Really were very important in being able to help elevate the work. We, you know, partnered with the Purple Purse initiative from Allstate, which was designed to, you know, raise awareness around domestic violence, and a lot of other great partners and sponsors that came to really support the work that we did. So what have we learned from this, and kind of what next? And so these are, I wish I could share all of the feedback that we've gotten over the past few years from these meetings. But like, one of the things that we really ask in all those conversations is, what are you going to do next? Like, as a result of today and this experience and this network and this learning, what are you going to do tomorrow? What are you going to do on Monday? And so we, you know, normally have these conferences on Saturdays, and we'd say, what are you going to do on Monday or Tuesday, like, to get out? So really trying to make sure people were action oriented, and there was a lot of inspiration. And we talk about both empowering, but also equipping. So like, we want to make sure you feel motivated, you're excited, you're like, you've got this high on Sunday, but then when you get to work on Monday, you know what to do. And so really pushing people to think about those kind of things. And so some of the things that people would share, I'm going to just share a couple of them. You know, spend time actually organizing my network, because people started to realize I might have a lot of people in my network that could be really useful already. I've just never really thought about it, and start to think about, how do I purposefully engage people to be mentors for me? Thinking about how to say no. And that was a really interesting one. I mean, minority women, regardless of which identity that means, really have a hard time saying no, and do it with such guilt and such stress that it's hard. So really kind of giving people tools to figure out how to say that was really, really important. People also thinking about kind of getting out of their day-to-day box. People would say things like, you know, I've never really spent time with a woman that's struggling with a disability to understand what it's like to not be able to see or hear or walk, you know, the way everyone else around them does, and what that looks like, and trying to understand kind of how do I know more about people that are not necessarily have identities I don't necessarily have. And then, like, you know, actually joining circles and finding those circles that could support them. And so that was really, really exciting to hear some of those next steps that people are ready to take. The themes, you know, the four major themes that we think we've understood from this movement is that networking at the conferences is actually very, very powerful. And so right now, in the midst of a COVID pandemic, I worry, like, how do we really make sure we create that same kind of magic in another way? But that is really an important piece of the movement. Providing materials at these conferences that actually help people further their professional development is really much needed. So like, really clear, we have really good handouts, and on each of those 10 ingredients, like actual action items and guidebooks and goal setting things. And those things were really helpful for people to actually use and be able to make next steps when they left. A really important thing was the diversity of the content. And so I think, you know, having different people of different backgrounds with different expertise and from various professions, various parts of healthcare. Some are in public health organizations, some are with departments of public health, some are with medical, academic medical centers, some are with health serving institutions, or maybe philanthropic organizations that provide resources or research dollars to health organizations. But having that diversity and experience and expertise was really, really helpful and important. And also, and probably most importantly, these have created a very safe space for people to just embrace their diversity and really realize inclusion. Even if they are alone in their place of work, they find a lot of power in these networks that emerge from this and the community that they're able to build. We ask people to tell us what knowledge or skills have they learned that they're going to, you know, that they're going to use that will help enable them to improve. A lot of very, you know, wonderful things that we've heard about people, from people, and how to build their own personal brand and decide and define who they are and be okay with that. And a lot of great things came out of that, and really had a lot of really, really positive feedback from all of the different conferences, and a lot of great activity that would happen, you know, while we were doing these things live. One of the things that's really exciting to me about the way this has played out is that, you know, it's one thing to really have like meetings, but I always say we went from a meeting to a movement, because as the work started to grow, a number of different cities wanted us to bring this to their city, and said, we really want you to be able to help us figure out how do we support this group of women, and what do we do to be able to do that. And we're so happy that so many cities, including the city and county of San Francisco, the city of Oakland, the city of Irvine in Southern California, the city of Pittsburgh, the Columbus City Council here in Ohio, all came together at different times and created Minority Women Professionals days in their city. So there is, January 28th is considered Minority Women Professionals Day in San Francisco and in Oakland, and each of these cities has a respective day that they've now committed. And that's a day where, you show love, you try to figure out what are pathways for leadership for these women, and it's really been empowering. We don't have a day yet in New York, but we do have a lot of support from the mayor of New York, who felt and wrote us a kind of a letter of support to share that he really feels like this is a really important movement. So really exciting to move it from just having meetings to really having recognition at the levels of leadership in the cities to do work. So I'm gonna pause here, and I can't see all your faces, but or your hands or any activity, but would love to know if anyone knows what this image is from, what video this is from. And if you do, I want you to think about it, and I'm going to share a different screen to show you something. And so give me 1 second to put the other one up. All right, so I'm going to play a quick video for you. Hope you can see it. I'm not sure if can you all see my screen? It's hard for me to know if you can. All right, I'm gonna assume that's a yes, or I'll look. You can see it. Okay, great, thank you. I'm gonna play just a few seconds of that video that the clip that you just saw. I'm gonna stop there. Hopefully that song might ring a bell. It's very funny to me because there was a time I was hearing my kids saw a commercial with that in there, and they were saying, they were like, oh, I started singing it, and they were like, how do you know that song? Because they thought it was a song that was in their generation, and were wondering how their mom knew it. But I laugh, and the reason why I shared that is because that song, Take On Me by AHA, is considered the most popular one-hit wonder ever. And so, when you think about one-hit wonders, I mean, we know that song. I mean, I was singing it as a kid. Now my kids are singing it as a kid. So it really has stood the test of time. But when you think about creating things like this and this movement that we've started to build, you wonder, is this really a one-hit wonder? Would we be able to continue success? Can you sustain this? Is it something that can scale? And how would you be able to do that? So I've been thinking a lot about how do we do it? And we started to think about what would we look like? How would we do it differently? And so how would we take this into another year and another year and another year? And so at a phase now, we're really thinking about how do you really focus on the skills that people are really getting from this and start to really be more purposeful in the content that you arrange. We, have had out of that, initial 5, we had, a number of other conferences that we've been really excited about. And again, I'm skipping over some of this because it's really more demographic stuff. And some of the lessons that we've learned from that have been similar in other places, but really making sure that we start to, make the content even more purposeful and intentional around the things that are really bothering and challenging the women that we're doing and we're working with, and helping with things like people say, I need more help with how to come up with a real career vision. I don't really know how to apply design thinking to the work that I'm doing. And so we're trying to really figure out how do we make sure that the content is more purposeful. So, really, where are we now and kind of what's next? As I mentioned, this is a group of volunteers, people that really just resonated, this mission resonated with them. They felt like they wanted to be engaged in some way. I love this picture that somebody took, because at the end of all the conferences, we would do something that would get people moving, and we would do like a line dance or something. And some people didn't know how to do it, but they're like, I'll just come out there and try it anyway. And it was so much fun to see this happening, and even get, some of our other guests to be part of it. And the reason what this shows to me is like, when you start to get people to like just get up and move, and you've got like, the dean for diversity at Harvard Medical School out there on the dance floor with an undergraduate student who's looking to go into something in healthcare on the dance floor, like trying to do a line dance. People just start laughing. It just brings out all this emotion that was just amazing. And so trying to figure out how do you kind of take that kind of energy, that enjoyment, that love, that passion, that shared sense of community, and turn that into something that you can package and redo and keep that momentum going. How do you redefine the angle? Now we've got this pandemic upon us, but like, we cannot stop working because we know that the space is necessary and people need it. And so I'm never going to stop empowering, going to kind of always be doing that regardless of what I'm doing. And we'll continue to figure out, what does this look like in a COVID world, but how do we keep people smiling and build those communities? So back to where I started, we know that these women are often, minority women professionals are often underrepresented in leadership, particularly in all the different health professions, but building partnerships with different colleges of medicine, schools of colleges of public health, offices of diversity and inclusion can really help you build success. And even if you have a really strong, successful national program, building those networks locally to have people kind of have a shared sense of responsibility and community is super, super powerful. And so I really, really appreciate the time. I'd say that we are on a mission to support diversity and continually invest in changing the world one MWP MVP at a time. So with that, I will stop and I will take any questions that you might have from me or any comments.
All right, we will start with the Q&A period, but before I get started, I just wanted, again, on behalf of both of the societies that kind of put this together, both the College of Public Health Alumni Society and the DEIC of the HSNP Alumni Society, we thank you so much for this presentation today. I think this was very enlightening for all of us. You're doing a lot of great work, and I think this is very inspiring to see somebody in your position just kind of giving back and giving us some cues on what we should be doing and what we could be doing to be great. And so thank you again so much. We really appreciate it. I will kick off the first question, and I'm going to continue monitoring the chat box as well. But what advice would you give to students or early careerists to get involved with maybe mentors or to be involved in different conferences, just to kind of give them a hand up when they're going into the workforce and knowing what to expect?
Yeah, so thank you for that question. And I would definitely encourage, particularly people the students, I should have mentioned this. So at the University of California, Berkeley School of Public Health, there was a student organization that had heard about some of what we were doing, and they reached out and said, we have all these public health undergraduate students that are really interested in getting involved, and how can we figure out a role for them? And I saw it as a really great opportunity to have my team of folks, which was again a group of volunteers, provide some mentorship to these young women that were interested, and also give them a chance to be able to help us think through, what do students need at these conferences. We had a lot of breakouts, and they ended up, there were probably about 7 or 8 of them from that student organization that just offered to be part of helping with the planning or logistics. And in exchange, we made sure that we understood a lot about what they were interested in, things that they might have questions about, and made sure that we paired them up with people that were going to be attending the conferences or a part of the network to be able to build those communities for them. So I would say that as students, you have student organizations. A good way to really get in the door somewhere and just get visibility into what people do is to offer to just spend time, even if you got 2 hours a week where you can just help with something. And I can't imagine any organization that wouldn't have something that you could potentially help with, whether it's like, a department of public health, or whether it's a research team or whatever. I just feel like there's always that opportunity. And that's why I'm very, very sensitive when students do reach out to me and say, I've got something I'd love to be able to do. Like, I would just try, I usually try to figure out a way to give them, because mostly what they need is the exposure and the mentoring, and to kind of know how things run. And then they can start to decide from there, what else they need. And usually I might be a portal for someone, just they don't necessarily need to understand me per se, but they need maybe access to the network that I have. And if I can be a conduit to facilitate that, I will. So I would say, use your student groups. There's power in those numbers to say, like, we are the association of whatever students in the College of Public Health, and we'd like to know more about this. Is there a way that we could be useful? I think if you do that outreach, you'll probably get really good results.
Awesome. Thank you so much. And I know we have lots of students on the call, but I know that we also have lots of people who are already in their careers and established. And so if I can flip that question on you a little bit, how would you recommend that minority women professionals can be mentors to other young women who need a mentor?
Yeah, I will answer your question, but I'll also add another piece to your question, which is also we should not assume that women who are further along in their careers also don't need mentors, because like even at the stage that I'm at right now, I feel like I need a lot of mentorship still. So I feel like I'm in a sandwich position where I'm obviously mentoring a lot of people, but I also still need a lot of it. But I think as faculty, as managers, as directors, or people that are in positions where you have the opportunity to mentor, one thing I would say is be visible, right? Just visibility alone. Like, we have a student association at the College of Medicine, the Student National Medical Association, which is a association of Black medical students across the nation. And they have them at chapters at a lot of different colleges of medicine. And they've asked me a few times to come and talk, to them, or just have conversations with the students, just so that they can see a Black woman chair. It's not even, I don't even know how much of what I say is really necessarily that groundbreaking to them, but just so they can say, okay, so that is a thing that I could be. And so even sometimes just the visibility and having a presence and being aware and kind of letting people reach out to you, I think is a wonderful thing. And if there's not an opportunity that you know of to do it, maybe just reach out, because like the colleges of all of our, all of our health sciences colleges, they definitely have different student groups based on, affinities or passion areas that would love to have people that are out in the field doing the work in these different healthcare settings, coming and sharing things. So I think if you don't see it, if you don't have immediately people kind of coming at you, maybe reach out and say, hey, I'd love to talk with the Humanism Society or the whatever, group at the college, respective college. And that's another way.
Awesome. So we have a couple of questions that are popping in the chat again. So the next question is, what organizations and groups around Ohio State and Columbus in general can they join related to women's empowerment?
Yeah. So I'm still relatively new back here, so I'm still learning a lot, but obviously the YWCA is always a good place to start in any city, to look at how to focus on building women and young women and girls and women at various stages of their career and life. So that's always one that I would just put out there immediately. And I'll do a kind of a selfish plug for Ohio State's non-for-profit called PACT, which is Partners Achieving Community Transformation. And it's led by a woman named Autumn Glover, who is just an incredible and powerful figure who has done a lot of work in revitalizing and building up the partnerships between the university and the Near East Side of Columbus, which has had, a lot of economic devastation and challenge and a number of different vulnerabilities, but doing a lot of work to really rebuild that community. And they have a lot of programs that are dedicated to empowering and providing, that was my alarm to stop talking. So I guess I beat the timer. But they have a lot of organizations that are dedicated to, a lot of work that's dedicated to uplifting women and girls and doing even just job help, resume building workshops. So anything that they are always looking for people to help provide some of those services. There are a lot of volunteers, a lot of community-based service through that organization. So that's another one, a very, very good one, because it's a lot of it is like job training and preparation, community rebuilding type of activity, empowering women and girls through various stages of their life cycle, helping them navigate complex systems for healthcare or for jobs or things like that. And so that's another one that I would suggest. And it's called Partners Achieving Community Transformation, PACT. I can't remember the website, but that's, if you look that up, you'll find it. It's Ohio State's nonprofit affiliate.
Awesome. And I would second that if my opinion matters. Great organization.
Yeah, that's true.
People in Columbus. I think it's awesome. So it looks like we have another one, and this is a question I know lots of us on the Zoom right now are wondering, and we appreciate your sharing on this one. But what advice would you give for navigating pushback in the quest to empower minority women?
That is a great, great question. And, I didn't touch on that. So what I showed you today was the great success and support that we had and have had and continue to have for the work that we're doing. So that's what I showed you. What I didn't show you was the resistance and the pushback to the movement. So I think it's actually really important that that was asked. And I'll say that I don't know what it is, but sometimes when you are going to start to align affinity groups for around a certain cause of empowerment, that's going to give people a voice and or more treble to their voice, more bass to their voice, and more confidence in themselves. Someone is not going to be happy, right? And I don't know for whatever that initiative might be. I don't know who that unhappy person or group might be. Some of the original pushback that I actually got about this when I first started kind of pitching it to different people was that it was exclusive, and why minority women. And so, and I think if you remember the earlier slide I shared, that I actually ended up defining it very broadly, because I felt like if we don't say disability, no one's going to include folks with disability, right? If we don't specifically say religion, right, like we'll still be marginalizing some groups. And so kept it very broad. And if you saw the cover of that book, it was very, very intentional with the imagery that I had put on there. But even though, I thought it was pretty inclusive, people say like, well, it excludes all of the women. I said, well, it depends on how you identify. If you come in, you say, I'm a white woman from a majority group, but I have grown up poor and I feel like I've always been in disadvantage because of that. We want you, like there's no, so I think, but anyway, anytime you're trying to do something where there are certain groups that you're trying to focus on, there will be pushback. And I think you just have to fight through it. And sometimes you don't necessarily need to be, you may not be able to be successful at being all things to all people. I mean, we tried to have like a disability theme and maybe a religious theme, like built into all the things. We couldn't do it every single time. And so don't, just be okay with what you're trying to focus on. Now, the other thing that I got pushback on was that it was only for women. And so, again, I guess the same things apply here. I don't have anything. You saw in some of the pictures there that we had men that came to our space. I had, when it was possible, I took my son and my daughter. I wanted them to be part of it. I had, if I was in a city where one of my brothers or one of my cousins would, I'd be like, come to this thing and be around these women and show your support, right? And they would come and they'd be happy and they'd be like, this is great. But I never felt like this was a all minority everything meeting. Otherwise, that it just would have taken away from what I think is a very unique need and a double jeopardy situation for that intersectionality that minority women have with their gender. And so I think it just, when you get the pushback, maybe it'll make you ask, what am I really trying to do? Like, what am I really trying to do? Who am I really trying to impact? And maybe you'll change your mind and say, you know what? Yeah, maybe that pushback is valid and I should focus on it. But maybe it'll make you stronger in your convictions. And all that really did is make us feel like we're just gonna, let's be sure that this is what we're saying and this is who we're focusing on. And then if we've decided that, let's run with it. And that's what we did. So don't expect it to be easy. I mean, people don't present in the presentations all the other stuff. We present all the glory. So, but definitely stick to what you want to do once you're sure that that's where you're headed.
Yeah, I think that's very important as well. And I think when we think through these things, especially in the environment that we're currently in, one of the most important questions that comes up is, if we're receiving this pushback, we're pushing through, we're doing what we can to get where we need to be. What about us? What about dealing with ourselves? And so the next question that's in the chat box is, what do you recommend for self-care when you're the only woman of color in a space or in a leadership position? Yes,
very, very good question. So this is really a very interesting thing. And I have this really interesting story in my mind about sometimes why it's important to have people with shared identities in leadership positions when you're working that can understand. I'll tell you this, and if this is a story. I had a woman that worked with me when I was in California, African-American woman who, unfortunately, I was her boss, and so she was pretty junior, and she reached out to me and said, text me one morning. I was on the subway on my way into work, and she said, I'm not gonna be able to come in today. Took out my braids last night and have a whole disaster on my head. And that's what she texted me. And then she's like, unless you want me to wear a scarf or come in some other way, or what do you want to do? And, it was like, there's one of these things where I'll never forget it, because I was like, I completely understood what she was talking about. Like, just a bad Black woman hair day. And that is, it's significant. And then it's not one of those things where it's like, oh, just, do something, get in. Like I knew that what that meant and what that felt. So I said, you know what, just deal with it. It's fine. Just work remotely. We'll figure it out and let her go. But I remember thinking about that as an example of like, man, if she had called if her superior or her boss, or manager or leader was not someone that could even in any way understand what that might have meant and the stress that might have caused her, that would have been a really hard thing. So one of the things that I've done as a leader is try to normalize self-care. Like it's not an extra thing. So for example, on my administrative team in my department, I require that every single one of my administrative leaders takes at least one day a month, but up to two, that is just a wellness day. And it's not vacation. They're not using their vacation time for it. It's a day that I mandate because I believe that you need to take a day off no matter what. Like, and you just have to do it. And you can work all day if you want, but I don't want you to, but I want you to not be on. And I don't see it as vacation because you're not necessarily going anywhere or doing anything, but it is, I believe that day off is important for you to thrive and be productive on the other days. And so I've actually built that into my leadership values structure. Like if you work on my team and you're on my administrative team, you're going to be required, and you tell me, just put it on my calendar, let me know the day you're going to be off, and I know, and I won't bother you. But making sure that that's built into the way I see productivity. Like if I believe if I do that, they will be more productive. And I've seen time and time again that is true. So, trying to figure out how do you create space. And the last thing I'll say is that a lot of times people don't realize the space you might need for your own care. And so you will have to set the boundaries yourself. And I wish I'd learned this earlier in my career, but it's something that I say all the time when I talk to people who are coming behind me, or even people that are my peers. Like, you have to explicitly ask for how to protect your space. I mean, sometimes that might mean like blocking your calendar. You can't schedule things during 12 to 1 because I want to eat, and I don't necessarily want to eat during meetings, right? And I want to just have a minute to decompress in the middle of the day, or set boundaries around weekends or evenings, and don't respond. I know some of my team members, they know that I stay up late. I don't sleep as well as I should sometimes. And so I'll say, like, I'm going to send you this text, but don't respond to it till tomorrow. But I just want you to know that I'm going to forget it if I don't send it to you right now. But, it's very clear that I'm not expecting you to do anything. Or I'm going to shoot this email to you, but, this isn't really necessary for this evening. But really set the boundaries, because no one will know. Or maybe they'll know, like, oh, she has kids, or she has this, or she has that, but they won't necessarily care. So you have got to really take the initiative to try to create the boundaries for yourself, and maybe talk with someone that you trust on how to do that, right? It's not easy to just say, like, yeah, don't talk to me after 5 o'clock, right? Like, I mean, that's not easy. You have to be very empowered to do that and feel like you have a strategy to do that. So just think about, like, where do you need to protect your space to just get some balance, and the opportunity to get care. And then talk with someone that you trust on how you might be able to do that, given the dynamics of the organization or the group that you work with.
That's awesome. The next question that we have is shifting gears a little bit, but it's kind of more about lessons that you've learned and how we can extend those lessons into our own personal, professional areas. And so how can we extend the lessons that you've learned with older pre-professional or professional demographics to help connect students to the same support system? And specifically, this person is asking about their work that deals with high school and middle school minority students that they're working in through a pipeline.
So do you mean, how do you do work in the middle school, high school area, or how do you provide support for women who are more advanced in their careers, or both?
Yeah, how do you do work at that middle and high school level to help connect the students to the right support systems?
Yeah, I will definitely say that that's not an area that I've done for quite a long time. So I mentioned much earlier in my career, actually, when I was a resident in New York, I founded a non-for-profit called Girl Talk Inc. And what we did was provide HIV/AIDS education prevention for minority adolescent females, largely Black and Latina adolescent girls in New York City public schools. That was, when I did that, it was largely then me calling principals at schools and saying, the first school we went to was Frederick Douglass Academy in Harlem. And I called the principal there and I said, I've got this program. I really want to, is there a way that you can create a structure and opportunity for me to meet with girls? And I had a few other of my co-residents that were going to come with me. We wanted to do these programs. And the principal was super excited and really, really engaged, and really felt like this is a great idea. I think our girls need it. and gave us access to start to meet with the girls, and they figured out a way to kind of have the boys in the health class in a separate place, and we would come in once a week for 6 weeks and do this thing with them. And that was like literally calling principals to get access. I couldn't say, and that's from another phase of my career. I feel like now there might be more opportunities to connect with schools in a very different way, maybe through social media and through other formats, maybe through like districts as opposed to individual schools. So I'm not probably the expert to answer that question. I think my work has really gone to more of the college and above level, but I'm sure there are people in your network, in your CPH network, that would probably have good insight into that.
Awesome. So I'm gonna ask a larger question for you and kind of wrap things up and be cognizant of your time. What's next for you? What's in the future? What are your goals moving forward to continue to empower this group of women? And what kind of creative, innovative things are you thinking in your mind for moving forward?
Yeah, that's a great question. So as I said in that one slide, I don't feel like I'll ever be in a situation where I'll stop empowering and trying to empower and, leave my mark. And so, I'm already doing a lot of that. I just kicked off an inaugural event the other night, 2 nights ago, called Black Women in Medicine, which is bringing together Black women, medical students, administrators, staff, faculty, residents across Ohio State, the College of Medicine and the Nationwide Children's Hospital for our first event, because it was something that those medical students have kept on saying, like, we really need it. We need to see more people. We need to understand. We need to have this network. We need to have this space. I felt like, it was one of those things where enough people said it to me that I felt like they want you to do it, Nwando, like, not like, oh yeah, let's all wait for the person that's going to do it. Like, and so that is a really important next thing. I mean, we literally just had our first conversation on Wednesday night. And we had about 60, almost 70 women from across backgrounds join, and that was pretty impressive. And trying to figure out how do we captivate those folks and also capture that momentum and turn it into some really positive energy. So some things that came out of that conversation, we had different breakouts and things like that, trying to figure out how could we be useful. And some of the things we found out were things like some of our students really need interviewing skills, and they need to understand, like, they need someone that's going to help them understand some of the nuances of interviewing and having conversations with more senior people when you're a student. And so that's something I was like, we can easily create that, right? We can take all these people, all these women that are in various parts of the entire medical center and health sciences colleges could easily come together and kind of create something like that. One of more mentoring, or one of the group to be more service oriented and start to work with organizations like PACT or others to try to be present and visible in the community. So I think that's an important thing for me here now, is to really figure out how do we respond to the needs of a number of our students and create opportunities to provide tools for them. In terms of the larger kind of conference vision, really, really trying to think about that. Honestly, Reed, I think, with COVID, it's kind of thrown a wrench in everything. And, part of me is kind of waiting to see, like, how does it die down? But will we ever be able to have 300 women conferences again, like, in person? I don't know. And maybe not in the near future. So, I'm actively thinking about what this next phase looks like. I'm not totally sure that, a big Zoom is the thing to be able to get what I know that we have experienced in this setting. So I'm not sure, but there is an answer, and it doesn't, COVID doesn't stop the need for people to be empowered and have resources and to network. So stay tuned.
I was going to say, if you figure that one out, how to connect with people over a large Zoom, let me know too.
Yes, I know.
It's like the question of 2020 is how to do that. So, but I really just wanted to thank you again, Dr. Olayiwola, for taking the amount of time that you did to talk to all of us today. I know I really enjoyed and got a lot out of this, and I know I'm speaking on behalf of all the rest of the people on the phone. So we really, really appreciate your time. we would love to connect with you in the future. I've already seen a few things that are like, let's do this with her and let's do that with her. And so just look forward to us connecting again. The last thing I would say just to everybody is just to take the advice that was kind of given in this presentation and think to yourself, after hearing all the things that we've heard today, what's next for you? I know that you like to ask people, what are you going to do in the next day or the next week? And so just really think about that, and let's join together to empower this group of people because they need it. And I think it's our duty, right? So let's do it.
Let's do it.
All right.
I love it. That's a great note to end on. Thank you so
Thank
much for
you.
having me, and thank you all for the wonderful organization of this event. Okay.
Thank you
Bye, everyone.
so much.